Millions of Americans visit the hospital every year, expecting to be treated for an illness and get better. But a new survey shows some hospitals may in fact be making you sicker. News 8's Brittany Schmidt joins us now with the details. Brittany.
Mike, every year about 648,000 hospital patients develop infections during their stay at a hospital, and about 75,000 of those die. In an effort to bring attention to the issue, a new Consumer Report survey compared the infection rates of hospitals across the United States, including the two in La Crosse. When you walk into a hospital, you expect to be treated in a clean and healthy environment. However, Consumer Report's latest research shows some hospitals are not performing well when it comes to avoiding patient infections.
We analyzed hospital-acquired infections data for thousands of hospitals across the United States, and we rated hospitals based on how well they did at avoiding MRSA and C. diff infections.
Here is a look at Gundersen Health System and Mayo Clinic Health System's score when it comes to preventing infections. Gundersen ranks below average when it comes to avoiding infections and avoiding surgical site infections, but ranked above average when it comes to avoiding MRSA infections and average when avoiding C. difficile infections. Mayo ranks average when it comes to avoiding infections, but below average when it comes to avoiding surgical site infections. Mayo also ranks average when avoiding MRSA and C. difficile infections. At first glance, these rankings may be shocking, but it's important to note the data used in the survey was collected between October 2013 and September 2014. And both hospitals say work is already underway to improve.
Those are areas that we've put special effort into over the past few years. You pointed out the surgical site infection metric there, and that's one that I'm pleased to say we have improved on since this data time period.
We have folks that devote their careers here to things like patient safety. And so we're constantly working on different initiatives to improve infection rates, falls, medication, the appropriate use of medications, and so patient safety is very important to us. It's a full-time job for many of us.
The survey portrays just one snapshot of the complex healthcare system, but both local hospitals say it's important for the public to know where improvements need to be made and when improvements are made.
Patients should feel part of the healthcare team. They're the most important part of our healthcare team. And so if they have any concerns, if they have any specific concerns or questions, we would encourage them to ask at any time.
We want patients and families to be able to get access to as much information as they need to make informed choices about where to get their care.
Research shows a lot of the infections in hospitals are caused by superbugs, which are created from the overuse of antibiotics. Both Gundersen and Mayo have what is called an antibiotic stewardship program, which keeps a close eye on what antibiotics are being used and how much is being used as well.
Thanks a lot, Brittany. The Consumer Report compared thousands of hospitals throughout the entire United States. If you would like to look at the results for another hospital, we have a link on our website at news8000.com.